Hey guys, so it's Casey, and vasopressin was my drug for this presentation. The therapeutic class is a hormone drug for vasopressin, and the pharmacologic class is an antidiuretic hormone and a pituitary drug. So how does vasopressin work? Vasopressin is also known as synthetic antidiuretic hormone, ADH. It works mainly on the distal tubules and the collecting ducts of the kidney. So what we know about ADH is that ADH is responsible for water reabsorption in the body, so vasopressin works by increasing water absorption in the kidneys, similar to how natural ADH works in the body. Indications of use, it's mainly used in diabetes insipidus. So what's happening in diabetes insipidus is that we have a lack of ADH being produced from the posterior pituitary gland. Because of this, we're going to have an increased amount of urine and an increased amount of excretion of urine. So when we have normal ADH, ADH again causes reabsorption of water in the body. So with diabetes insipidus, when we give vasopressin, we're going to decrease that urine output and we're going to have more fluid being stored in the body. It also works with pulseless arrest. So this works with pulseless arrest by vasoconstrictive effects on the smooth muscular receptors. So with these vasoconstrictive effects, we get vasoconstriction. With vasoconstriction, we will get restored circulation. So that helps with pulseless arrest. The vasodilatory shock, it works in the same way with the vasoconstrictive effect as well. Gastrointestinal hemorrhage. So vasopressin actually has a stimulus effect on the vascular of the GI. So when patients are having any kind of GI bleed or anything like that, they can be given vasopressin, which will decrease that GI bleeding. Some adverse effects of vasopressin is that it can cause a myocardial infarction. It can cause angina and chest pain. These are all because of its vasoconstrictive effects on the smooth smooth muscle receptors, as stated before. It can also cause water intoxicity or fluid overload. So the number one thing we need to see with these patients is that they aren't going into fluid overload. So we're looking for signs and symptoms of this when giving vasopressin because it is reabsorbing water so much. Our patients can also get dizziness, a pounding sensation in the head, abdominal cramps, and nausea and vomiting. Some contraindications with this medication that we need to be alert for is that we do not give this medication with any known allergy or a patient who has had a hypersensitivity reaction to it. For patients with a known seizure disorder, we also try not to give this med. That's because an adverse effect of this medication is that it can cause seizures. So if someone already has this disorder, it's likely to cause it, so we don't give it to them. Patients with a history of asthma are not advised to take this medication. That's also because of the smooth muscle receptor effect. Any patient with a past history of cardiovascular disorder as well. And then patients with renal diseases or insufficiency are not advised to take this medication either. So that's vasopressin, and thanks for learning about it with me.